Okay, I promised, right? I told you I was gonna share the lies that so many of you have been told about this NCLEX exam. To be specific, there are at least 7 lies that I've picked up on after doing consultations with thousands of nursing students. Here's the thing. The student calls me up or texts me, they let me know they want to do a consultation, and they pay their $25 in PayPal or, Cash App, and I get on the phone with them and it's like I got to play the tape back, y'all. I mean, like I got to press rewind because the story is all the same, and it's driving me crazy because it's criminal, to be honest with you, that this bullshit keeps being taught to one student after another, and these students are like really believing this crap, and it's causing them to fail. So let's go over it one by one, shall we? Let's start over here. Probably the biggest lie that nursing students are being told is that they just need to do a bunch of NCLEX style questions every day and they can pass the NCLEX. In particular, they're being told, buy the U World, do all those questions, and you got this. Well, guess what? I actually think U World is the best product out there. However, that's not going to cut it by itself. See, my classroom is full of nurses who thought if they just do a bunch of questions, they will pass the test. No, boo, you got to learn the content. The questions are fine if you got those exact same questions on the NCLEX, but you don't. In fact, they ask things in a way that make you go, did I ever even learn that? So my point to you, when you're told just do U World questions every single day and you're gonna pass the NCLEX, that is not true. In fact, it's not true because the content, the basics of the systems of the body were not there to begin with. So I do have nurses who, if they went to a really good school, if they worked at a hospital during their nursing program, if they got some type of background in medicine or healthcare, if they had a really great clinical experience, then U World will probably be all that they needed. And like I said, I love U World. The problem is you didn't get the greatest clinical experience. It's called COVID. COVID fucked up the game. Remember, you had almost like no clinicals. You might have had some simulation, some online crap. None of it really equates to clinicals. A clinical experience puts the reality to the book that you read or you learned about the system in. So yeah, so that was the first lie. Let's do lie number 2. Lie number 2, I think, is just like, your girl, thinks of it as like common sense, but it's not, because really smart people keep saying it, and YouTube videos keep teaching it, and teachers and schools keep promoting it, and software keeps selling it, and it's all bullshit. Here it is. If you score 60s plus, you're good. You're gonna pass. Okay, I tell my students very often to ignore math on NCLEX, but do the math before and after NCLEX. Here's what I mean. I failed math in nursing school. I'm standing before you, a PhD prepared nurse who teaches everybody. You'll be fine with math. But my point about do the math is that when you hear crap like this, if you score 60s and above, you're good. You have to say to yourself, okay, hold up. Let's go back to 4th grade when you learned percentages and you learned that 60% out of the 100 that you need is basically failing. Yeah, 60%, 65%, 70%, failing. So I tell my students, if you're gonna pass this NCLEX exam, you sure as hell need more than 60 on your so-called NCLEX software. What would I prefer you get? Because again, we do have a really, really outrageous passage rate. I need you to get 85 if you failed before and you're an RN. If you're an RN and you're taking the test for the very first time, try 80%. That'll get you over the hump. What about the LPN? Well, 75% would do you real good. So think of it logically. 60% sucks ass. It's not passing. It's not passing in anybody's book. So why would you think you could pass NCLEX with the 60? Is it because you did those UWorld questions and you took that UWorld pre-assessment or that Archer pre-assessment or any other pre-assessment and they said, oh, boo, you good, and you went and failed? Yeah, that's what I see every day. Like I just spoke to 10 people yesterday alone who all said their scores were in the 60s with Archer or UWorld or whatever. And they all failed. Oh, it like drives me crazy. So let's do lie number 3. Oh my God. I've been saying this for 20 years about Saunders. And now I just have to throw Archer in there for good measure. Archer and Saunders is good for preparing for NCLEX. Listen, in my experience, and that's all I can speak on, is my experience, you know, like 40 years as a nurse and 20 years as an NCLEX instructor. In my experience, both of those are going to doom you for failure. Saunders is outdated and sometimes kind of outright wrong in my experience. Archer is not anywhere near hard enough for you to call yourself ready to pass an NCLEX. Oh no, honey, I bought Archer just to test the software and it was too easy. And I'm telling you, this test is not easy, okay? So no. Saunders, Archer, get rid of it. Don't use it. Don't buy it. I don't think you will do well with it, in my opinion. Freedom of speech lets me give you my opinion all day long. And I'm telling you, in my opinion, get you something else. All right? Next, let's go to lie number 4. If you are an LPN, this RN test should be easy. Oh my God. So when I look at who fails NCLEX, the number 1 person who fails NCLEX is the English second language student born outside of the United States trying to take the NCLEX. The number 2 person that has failed the NCLEX is that almighty bridge student, the student who started out as an LPN and now they're trying to take an RN exam. And there are 3 reasons why the LPN to RN fails. So when we look at lie number 4, that this will not be that bad if you're LPN, well, here we go. Number 1 reason why the LPN has a fairly high failure rate when they're trying to be an RN is the fact that they work a lot. Some of them even travel. They work so much that they don't have time for studying. They took that LPN exam and thought it was a breeze, so they think they're going to step into this RN exam and kick its ass. It never happens. So what we see is that this LPN is focused on making that paper, buying that bag, going on that cruise, doing that vacation, getting that car, paying that note. I hope I called you out, because you, my love, need to understand that you got to put some work in it to pass this RN exam. It's not quite that easy. The second reason why the LPN to RN doesn't do well is because they went to some highfalutin, quick and easy microwave college who promised them an accelerated program and get them out of there real quick, like a microwave. And it turns out to prepare for an RN exam, you needed a crock pot, because that school skipped over a lot of the basic stuff that's on your test. They skipped over some of the easiest things that you would think would never be on the test. And so there you are in this accelerated program, and this test is going to ask you stuff you've never worked in. Because see, the problem is usually the LPN to RN works in long-term care. And so when they get those maternity and pediatric and growth and development and psych questions from straight hell, they can't handle it. They can't believe it. They're like, whoa, I had so much maternity on my test. Oh my God, there was so much growth and development. I just don't remember that. I mean, I learned it in LPN, but I don't remember it. Ooh. Third reason why the LPN to RN fails. You guys learn bad habits. You're working in long-term care. They're taking shortcuts. They're teaching deliberate bad habits so you can get through your 42 patients in a weekend. And there you are on this test, not understanding that the test is really based on perfection and book and perfect hospital with great staffing and rich patients and the whole nine. And there you are thinking, this stuff doesn't happen. I remember distinctly so many of my LPNs, they'll be taking my pre-assessment exam that I give you to see like, where are you and how long are you gonna be in my class? And they'll take this pre-assessment exam and we'll go over it and talk about some of the questions. And I'll talk about the question about the patient who's, you know, crying and saying that they can't go to physical therapy because they're in so much pain. And they'll say, I mean, more than one LPN will say, oh, they always say that, they be lying. Okay, let me help you with this. On NCLEX, the patient is not lying. But see, that's your experience at your long-term care, that patients are lying to get out of going to physical therapy, and you done took that little lie onto this test, and it's just all BS, okay? So I'm gonna need you to know that if you're an LPN, you're probably gonna have to work harder than you ever thought to pass this RN exam. I have so many testimonies on this HETV page of LPN to RN, and they were an LPN for 11 years, they were an LPN for 10 years, they were an LPN for 7 years, and they straight out failed the RN test 3, 4, 5 times because they are approaching it as an LPN, not as a brand new nurse with nothing but book knowledge and good habits. Okay, that's a big one, guys. I hope you really heard me on that. Here is lie number 5. If you get good grades in nursing school, you're gonna be fine. Oh God, I wish I could say that was true. And honestly, depending on what school you went to, it's the farthest thing from the truth. I don't know what was going on yesterday, but I talked to at least 7 students from Florida, and y'all got something called Ideal Professional Institute down there, and y'all just keep failing. So I decided to start asking the student as part of my $25 consultation, did you go to a good nursing school? So the young lady said yes. I said, oh, okay. What school was that? Here we go with that Ideal Professional Institute again. And then I said to her, I said, well, how do you know it's a good school? Well, because I got good grades. No, that is not the right answer. My question to you was, how do you know the school is good? Oh, well, we all did pretty good. So I was just listening to her because I'm doing a consultation and we're going back and forth. And I'm a multitasker every now and then, not often because you can't really multitask that great. But I decided to look up the school. The school had been on probation. The school had lost its accreditation. The school apparently had a very low passage rate. So let's just think about that. You went to this school who was on probation, who lost its accreditation, who had a low passage rate on the NCLEX, and you thought because you got good grades at that school that you was good. That same nurse failed that test 5 times. And as sure as shit, I get off the phone with her, and here's another student who went to the same school. Now it's making me nervous. So then I decided to do a little historical reflection and looked at all the consultations that I've done just in a couple months. And they go to this school, quite a bit of them. Oh, don't get it twisted. It's not the only school in America that sucks ass. There's one in Columbus. It's called, oh my God, AIMS, American Institute of Alternative Medicine. It sure is alternative medicine. In my opinion, it's alternative medicine from out of this world, probably on Jupiter or Mars, because the medicine they're teaching and the nursing that you're getting out of there is not helping you pass, because I get all of their students in my class having failed 2, 3, 4 times. So no, if you got good grades at a bad school, look forward to failing NCLEX. Do your homework. I hope that you can tell people so that they don't do what you did to look up the school's passage rate. We do more research on a pair of boots. We do more research when we're looking to go on vacation than we do our education. And education is power. And it's the one thing nobody can take away from you. No man, woman, or power out there can take your education. So it's the biggest and the best investment you ought to make. So stop going to these crappy schools. And if you don't know if your school is crappy, give your girl a call. I'll help you out because I'll do the homework. That's what I do. Okay? Lie number 6. People. Most of our nursing schools have something called HESI or ATI. You take this test, you pass or fail, and you go to the next step. Well, we help you pass HESI, but some people pass HESI and they think, I'm good. Yeah, you might be. But I've had so many of you tell me this lie that you were told if you pass your HESI, you have a really good chance of passing the NCLEX. That's sort of true and sort of not. Because again, what kind of school was it? And I don't know about you, but I know at least 3 schools in the area that have found out that their students were cheating and passing around the actual answers to the HESI. Yeah, that's kind of shitty, but this is the kind of shit that happens. So there are no shortcuts. If you want success, you've got to put in the work. Isn't this like Labor Day weekend? Well, let's labor and get what we deserve, which is passing the NCLEX. So when it comes to HESI, if you pass your HESI after failing it 2 or 3 other times, that's a red flag that you might need a little bit of help before you go skating your little way onto the NCLEX. So when does passing HESI mean you're gonna pass the NCLEX? You went to a good school. You got decent grades, did not fail any nursing classes whatsoever, never got anything like a C in anything you did, and then you took HESI on the first try and you passed. Oh, I got you, girl. You don't need no review. Take your little happy old self, girl, and take that test because you are good. You're the bomb.com. So, like, you don't need me at all, okay? So I'm going to tell you that. Do I tell everybody they need a review? Oh, hell no. Because, see, I don't need the money. And I need to keep it real and always be honest because it's called integrity. So it would not do me any good to tell every single student that I talk to, oh, you need a review, call me, send me money, yada, yada. No, that's not of God. And I'm not that girl because again, that's criminal, right? That's lack of integrity. I'm going to tell you if you don't need a review, if you don't need to spend money. I mean, over 300 videos that I have for you are free. You probably will be okay. Yeah, so here we go. We're almost done. We've got our seventh lie that you've learned in nursing school or from a friend or from a teacher that's just straight up a lie. And this one, I'd have to say is the #1 reason for failure on NCLEX. You ready? It's crazy. It's totally retarded, but here we go. You deserve a vacation after nursing school. Yeah, you worked hard. You graduated. You have been successful. You have done a wonderful job. You succeeded against the odds. You've been through hell and high water. You need to go on a vacation, relax a little bit, enjoy the fruits of your labor, really celebrate your success. No. I wish I could tell you right now how many people made that mistake. I wish you would just look in the inspiring testimonies in my playlist to see everybody who took that vacation. You see, here's our problem. It only takes about 3 weeks away from school to suddenly really get dumb again. I know that sounds crazy, but it's true. Because if you're not constantly on the grind, in school, right out of school, into NCLEX style questions, software, doing your videos on YouTube, whichever person you follow, it doesn't matter. There's many of us that are really good. If you're not doing that, if you're not staying in the game, if you're not functioning in your head in nursing, if you're not going to work PRN or, no more than 20 hours a week, if you're not looking at the clinical side and reading about the didactic side and thinking about the lectures you've had and even the HESI questions you took, if you're not all up in it to win it, you're going to lose it, because you're going to come back from vacation and try to get back into studying, and then you try to study, and too many things are capturing your interest. Too many hospitals will hire you and get you started easily right away so that you can get some knowledge down before you actually get your license, all of which is really not good. You know how come I know that? Because many of you got those temporary licenses that they were giving out during COVID, and you straight up failed right after that because you were focused on a bunch of stuff, but not the NCLEX. Do not take the vacation until you pass the NCLEX, because then you really have earned it. And don't get it wrong. I felt that. I did. I remember graduating from Ursuline College. I remember graduating and getting that master's from Case, Western Reserve. I remember getting that PhD and thinking, good Lord, wow, that was hard. But I wasn't done until I took my boards. When it came to my bachelor's degree in nursing, I still needed to pass that NCLEX. And in our case, the NCLEX wasn't until July. When it came to getting my master's at Case, I still needed to pass nurse midwifery boards. I can't deliver a baby until I do. You see, you have to stay in the game. Stay focused, get real. Let's do this. Let's finish the job. Now, again, let me just say, the 7 lies that you learn that everybody, I'm not just making this shit up, everybody keeps telling me this stuff. They include, just do a bunch of UWorld questions every day and you'll pass. If you score 60s and above, you're gonna pass your NCLEX. Archer and Saunders is really good preparation. Lie number 4, if you are an LPN, the RN test shouldn't be that bad. Lie number 5, you get good grades in nursing school, you are going to be fine. Lie number 6, once you pass the HESI, you're good. Go take your NCLEX. Lie number 7, you deserve a vacation because you're the shit and you just finished school. No, you don't deserve shit. You deserve to study some more and pass your NCLEX. I love you. Maybe this came to you as really hard. I don't know. I'm just trying to tell you what I have seen in all these thousands of consultations that I do. If you think you might need a little bit of love from your girl, put a little plan together, get you a study routine, show you what to do every single day, what to buy, what to look at, what not to waste money on, then you can call me at 216-410-0936, or you can email me at CHELLYS NCLEX PREP@gmail.com. CHELLYS, that's with the S at the end. Y'all be fucking it up. Y'all be putting Shelly NCLEX Prep. No, CHELLYS NCLEX PREP@gmail.com. Now, I'm about to go on and get busy because when I get done with this video, I've got to post a bunch of case studies that I've worked on with you guys. Remember Grey's Anatomy case studies? Yeah, deuces. I'm out.